Hi, it's Jacqueline. I'm back with my next video. So today, as promised, I have on my friend John. John has done plasmapheresis and he's also done IVIG. And today we're going to go through his experience with both treatments, how they have benefited him, and his thoughts and recommendations. I will also have a list of the doctors that he saw in the description below. So if there's anyone that you would like to contact, you will have their information. So I hope you enjoy. I want to just say thank you to John for taking the time to go through his story with me. He's also in the military, so I always want to thank everyone for their service that's in our military and armed forces. Otherwise I have continued to do well. It is a balmy 117 degrees here in the, in the Las Vegas area. So that's been fun. It's been extremely hot, but otherwise, fortunately, my health has been good and I continue to remain on my same path. Anyway, wanted to share John's story with you and hopefully to share more similar stories so that I can continue to bring information. So thanks again and enjoy. So welcome to the channel. Today, I want to introduce John. We met through the groups. Somehow we connected, and as I've been saying on the channel before, he's done plasmapheresis. I know that's something that has come up, questions about benefits, etc. So today we're going to talk to John about his experience. So go ahead, John, I'm going to pass it to you. I just kind of want to go back. I know we're like almost on 4 years of this, right? So there's probably a lot of history with everything. And, you know, obviously for time's sake, we want to be succinct, but let's go back to like when you first had COVID and like just what your experience was initially with COVID.
So I originally contracted COVID in November of 2020 at work. And unfortunately, it was the original variant that I actually contracted. It was absolutely horrific. It was probably the worst virus I had ever fought. I remember I had like 103 temp, body aches, chills, everything in between. I pretty much had it. I didn't recover fully, quote unquote, until probably like 2 or 3 weeks. I was pretty much locked away in a room. Thankfully for my wife, who was bringing me food and just kind of making sure I was, well taken care of from a distance because I didn't want her to get sick. After that 3-week recovery point, I started getting weird symptoms. And what I mean by that, it was getting very severe chest pain. I then was getting tachycardia. I was waking up. I was hospitalized a couple times because of tachycardic. I would be in a deep sleep and all of a sudden wake up to when my wife would put the little tachometer thing on your finger. I apologize if I butchered the name. So my pulse would be above 130, 140 all of a sudden in its sleep, which is, pretty scary. So rushed to the hospital on those incidents, and then I started seeing cardiologists in the months following. Kind of was getting the same feedback of, hey, this is anxiety. I said, this is strange. I never got anxiety before in my life. I don't think this is anxiety. It's a severe, sharp chest pain that comes and goes. I think it's related to COVID. They would do an EKG, find nothing, clean medical history. So they were confused by this, the cardiologists. And then that's when my world kind of collapsed in the months following. I was still getting these symptoms. And then March of 2021, I collapsed on the living room floor and all my muscles all over my body started convulsing and twitching. I remember I was sitting on the couch and, my wife could see my muscles twitching all over my body, legs, arms. And I remember her saying, something's wrong. We need to get you to the ER. I was in a dazed-like state. I got to Yale New Haven Hospital. Once admitted there, long COVID, new thing, still physicians are unaware of it. They ran a bunch of tests. The only test that was strange to them and strange to me to this day was my ketone levels were odd. They said, are you on this sort of diet, no carbs? I said, no, that's not on any diet. I then went to use the restroom and I fell over. I had no motor function. I lost most of my motor function. I had to be held up by pretty much the assistant, those pillars that you walk by to get you to the restroom. And I just remember telling the ER physician, I'm in a dream. It's like a dreamlike state. Everything felt surreal in a bad point, not in a good dreamlike feeling. It was like a nightmare almost, because I'm like, I can't get out of this. I can't shake this feeling. I don't have my full senses. They kind of drugged me. sent me on my way home. Next morning, I woke up to my dismay. I was in even a worse state, where I knew something was very, very severely wrong. And I kind of was in that horrible dreamlike state. I had no control of my senses at that point. My wife started reaching out to the neurologist who years prior helped me with my Lyme disease, Dr. Peter McAllister. He immediately had sent me to get an MRI. MRI came back negative, luckily, but I was still in this dreamlike state. Again, could not drive, could not walk without assistance of my wife at this point. Was immediately got the opportunity that following Monday to see Dr. McAllister. I was pretty much bedridden up until that point. He does some testing. He could see one of my eyes twitching and then falling over in his office. He's like, well, I need to do a lumbar puncture on him. So he then sends me to get a lumbar puncture, spinal tap. He does right there. And they said, we need to wait the results before anything. Once we're waiting the results of that, I'm developing psychosis at this point. I'm bedridden. I was pretty much, quote unquote, drugged up by my wife from a physician, from Dr. McAllister, saying, hey, you have to put this in his food. I think it's brain inflammation. Mm-hmm. So I was in a really bad state. And in the coming days, finally, when he got the results, it showed that it was the worst inflammation he had seen personally in cerebral spinal fluid and CSF. So he goes, it's not in the gray, it's black and white. So he needs to be on steroids like yesterday to stop the inflammation. His brain is inflamed. So he immediately puts me on steroids, prednisone. I work my way up to 40 milligrams, not severely high, but in the coming month or so, I start becoming more coherent. I know what's going on around me. Before, I had no idea what was going on. Again, I was developing psychosis. I was more fully aware and tact of what was going on around me. I'm now able to use the restroom on my own, things of that nature. I'm still not able to walk without assistance at this point, but I'm working my way up there. He then prescribes me intravenous immune globulin, IVIG. I then go to war with the insurance company, not me, my wife, and my doctor, Dr. McAllister, and luckily got approval for intravenous immune globulin, which is pretty much stops autoimmune type diseases of that nature. And his belief was that it was autoimmune driven at this point, or something along those lines, which is flaring up the immune system to overreact. And he needs to calm that down.
Just to get a timeline. So when are we looking at this point when you start the IVIG?
So this is May of 2021 when I really started the IVIG. Okay. What's called the loading dose, which was absolutely horrific. I remember it's 4 days. It's 4 or 5 days. It's very aggressive the first time you get it. It's called a loading dose. And your body almost rejects it. I remember I was profusely vomiting, very dizzy. As me and you've discussed in the past, I don't know if it was Herx or what that reaction was, but it was definitely horrible. I don't want to experience that again, but I knew it was for the better. So the nurse is like, do you want to stop? I said, no, I want to push through this if this is going to make me better. So pushed through that. And I definitely saw results in the coming months. Over the course of a year and a half, IVIG brought me back to life almost. It was symptoms all subsided. And I apologize if I didn't cover those. Chest pain, palpitations. Again, previously tachycardia had went away. But the worst symptoms were the chest pain, palpitations, muscle twitching, rosacea, very weird symptom. Another one I always cite, I'm one of the very few that have this, is foamy urine. So all these symptoms kind of subsided. They just went away when IVIG was working.
And those
so for the next,
they were like your main long COVID symptoms, or what you just mentioned, like after the psychosis and kind of stuff subsides and you're on the steroids, you're basically looking at those symptoms are the ones that keep recurring.
Correct. Yeah, they kept recurring, and I kept continuing a very low dose of prednisone. They were trying to get me off of it. Originally in June of 2021, the doctor tried to pull me off of it after just 3 months on it. My body was just not ready without something to inhibit the inflammation, because the psychosis started coming back. So I continued the steroids. I found a sweet spot for a low dose. I was like on just 2-3 milligrams, where I was just getting by with it. And the IVIG was doing its job. I was getting that every 4 to 6 weeks, pending, what my body felt like. So I lasted great for 2 years like that. The only flare-up that really happened that I was hospitalized each time was when I had to get vaccinated. I was required by my job to get vaccinated. So I did get the vaccine twice, the Pfizer vaccine. And unfortunately, that was the worst thing I could have done at that time. because that hospitalized me and flared me up. The doctors kind of thought I was crazy because I went in, I said, I need a high dose intravenous steroid. And they're like, what? I'm like, that's the only thing that helps my body. I know my body. I'm like, trust me. So they were just like, we trust you, and gave me a high dose intravenous steroid for each occurrence. 40 minutes later, I walked out of the hospital like nothing ever happened. So yeah, so that pretty much brings me up until I'd say 7 months ago, where all my symptoms started getting. Oh, go ahead.
I kind of just want to, just so people understand. So the IVIG, you're getting about every 4 to 5 weeks. Is that what you said?
Every 4 to 6 weeks.
Every
So I
four
was feeling out my body, trying to get further out, further and further out. And if I could make it, I would. But there was also a hypothesis by myself, after doing my due diligence, and even my immunologist I consulted at Brigham and Women's, could Gamma XC or any IVIG product contain the spike protein that I was not receiving in the beginning. That's why IVIG was doing so well and working for me. And then all of a sudden, towards the end, it was doing the opposite. I was even feeling worse after getting IVIG. So my hypothesis, again, I'm not a physician, I have no idea, but I did my due diligence in reaching out to what's called Grifols, the manufacturer behind Gamma XC, and was asking the right questions. I said, well, are you removing the spike protein? And pretty much the response, I'm sure, is from a nobody that was saying, we can't comment on that and that sort of thing. But after asking pharmacists who attend these conferences, they were stating that they're not removing the spike protein. So somehow the spike protein is still getting in that clean blood product.
Right, right. So when you were doing the IVIG, say you would have a treatment, like I know the loading dose, you had that horrible reaction. Were you having reactions still, like when you were just getting the regular dose for like a day or so, or were you not getting any reactions after the loading dose?
I wasn't getting any reactions until like 6 weeks, like 5 or 6 weeks at first. I was doing phenomenal. Like
Okay.
the IVIG was working wonders for me. And I was almost spoiled in my mind because all my symptoms subsided. And I was like, I found the answer. There's nothing else I need. I just take this product once every 6 weeks or so, and I'm all better. And I was spoiled. And I always say to myself,
Yeah, so you were basically not having any symptoms during that period. You were functioning, would you say, normally, or did you
yes,
feel like recovered? And then they would start to sort of flare back up a little bit, and then you would get the next dosage.
I was functioning at like 90, 80, 90%.
Okay.
I was even reaching out. I had a doctor, Dr. Sandra Wainwright, who administered hyperbaric oxygen that we discussed. I did 60 sessions at Yale New Haven in Greenwich Hospital, and it was great. I thought it was definitely helping me. It wasn't curing me. Neither was the IVIG, but it was getting me to the point where I was functioning very well, and my body was doing what it needed to do.
Okay. And then, which we had discussed previously, is that possibly what's happening is when the IVIG, as it goes along, that there's potentially spike protein in it because more people have COVID at this point, people are getting vaccinated. So now when you're getting the IVIG, potentially you're putting more spike into your body. Maybe, maybe not, but maybe that's why it started giving adverse reactions. Is that kind of your hypothesis?
That's my belief. I consulted with physicians that strongly disagreed with me, and they're like, "That's crazy." But you know what? This disease, unfortunately, over your timeline, that's not that's the worst thing I'm being called. I'm okay with it because
Right.
everyone would say you're crazy at some point for exploring, just getting better and treating yourself. So it was very funny there, and they were like, "Well, that's crazy that they're doing that." But when I would again delve deeper in and talk to pharmacists that administer this product at different companies. They have a pharmacist convention. And I consulted with two different ones, and they both stated the same thing. There was a gentleman who stood up there and presented something commenting on intravenous immune globulin. He was doing a whole presentation, and the presentation was on the spike protein not being filtered out
Mm.
of Gamma XC. And again, I'm just using one pot product in particular, but there's all of them. To his knowledge, that he was testing or doing something along those lines, he said there's nothing being filtered out. So that is still going into the subject.
Wow. Okay. Did they give you any explanation of why they thought it quit working for you, or they just didn't know?
They said, oh, it happens where people sometimes it doesn't work for them or it just stops working. I was told, and then another physician told me, well, usually it just doesn't work at the beginning. So that's strange that it just stopped working. Others said, it can stop working at any point. So it was weird that it was working phenomenally for that year and a half. I was just my normal self, almost 100%. And like I say, I was very spoiled and felt like I was getting a product that not many were, and I can continue this until I noticed the ones I started using, the expiration dates we would go back, I believe it was 18 months or so, or 24, or how many ever months or years it was, we'd go back and know that's when the donors would donate, and that was during that COVID timeframe. So we kind of put the puzzle pieces together, and that's why I made the hypothesis. Well, it's not working, and I'm not getting the older batches that was pre-COVID. So that was the only thing that made sense to me.
Right, right. Okay. All right. So then that puts us up to, you said, about 7 months ago.
Yes.
Okay.
Up about 7 months ago, I had a doctor who was just absolutely amazing. Dr. McAllister and her were my two godsends that got me to where I was today. Dr. McAllister being my neurologist out of Stamford, Connecticut, and then Dr. Sandra Wainwright, who's attached to Yale. She actually was the only one, him and her, that were actually taking the time to ask the right questions like, hey, there's a lot of issues going on with this long COVID, and people are coming in. They were coming in saying, hey, can I get hyperbaric for long COVID? And she was actually taking the time to ask the right questions, and so was he. So she treated me with, over 60 sessions, which definitely helped. But she was, I was presenting her and my neurologist the studies and showing plasmapheresis.
Mhm.
And I stress this to everyone out there: if you're going to argue your case, make sure you have to do your due diligence. You have to pull up the studies. These doctors, unfortunately, not all, but some are not going to take the time out they're so busy too that they're not going to take the time out to find these studies.
Mhm.
Find these studies for them and present that to them after you read through it. I had to Google a lot of verbiage that I didn't know what it meant. But I did that because you're your biggest advocate, and you know that, Jacqueline. So
Yeah.
you're your biggest advocate. So if you and your family aren't going to take the time out, why do you think someone else is? So
Mhm.
I went in there, heavy handed with these studies, and the doctor's like, these are great. They took the time to read through all these studies and said, it's proven, it works. Let me see if I can get you plasmapheresis. So plasmapheresis is the process in which your blood is cleaned. It can go one of two ways. It can go through a neck catheter or peripheral through your arm.
Mhm.
And Yale actually offers it peripheral, so do a lot of other places. But I was so this is a big thing and very expensive. So again, that's where my doctors had to go to bat for me and kind of fight the insurance company, and rightfully so. But it went very smoothly with the insurance. So it was, hey, studies prove it. This is what this member needs. This is what his body's reacting like. We need this for this individual. Unfortunately, at first, Yale New Haven was not wanting me to do the procedure. The doctors there, not my doctors, all my team of doctors, I have like a football team of like 8 or 9 doctors, pretty much were like, yes, we all approve this. This is fantastic. We want you to do this. However, the unit doctor itself was against it because they're like, this isn't proven for this. Even
Mhm.
though it's a remedy, a treatment for autoimmune diseases, we don't know if it'll work on them, even though we have evidential, studies that I've presented. So after a lot of convincing and providing that documentation, I was allowed to do such. I did 10 days inpatient, where they put a neck catheter in my neck, which it's quick, painless, but it's not fun having a neck catheter in, and it goes into pretty much your heart, and it cleans your blood, and it's a fairly quick process. I would say it's about 40 minutes, 45 minutes. And so by just asking the nurses, I was doing 5 treatments in the 10-day period, and it was cleaning 92% of my blood roughly. and
Okay, now at
replacing
that
with
time,
albumin.
when you went in at that time, your symptoms were so the IVIG had kind of quit working. Were your symptoms really, really bad at that time? Had everything kind of flared back up because the IVIG wasn't working? Or how were you feeling when you went in for your treatments? Like where were you at health wise?
Great question. So unfortunately, I did this for the sole purpose of I had to get off IVIG because it was not helping. It was almost hurting. And I was increased on steroids. I was backed up to like 10 to 15 milligrams of prednisone again, which I did not want to be on. How bad, I'm sure people know how bad prednisone is long term.
Mhm.
So I was like, what can I do next? And I talked to people in Germany and other countries where they were getting help apheresis. A friend of mine in the long COVID group called Klaus, his name is Klaus, and he was telling me what a wonder it was for him. So I said, hey, does the negative it doesn't outweigh the positives. The positives outweigh the negatives. I talked to my physicians. I said, listen, is there any negatives? The worst case is that you get a pretty much an infected port.
Mhm.
And I'm like, that's it. Oh, okay. So where do I sign? They pretty much were okay with it, and I was able to do it. And I was super excited to start, like so excited. I did like backflips, and I think I was telling you as well in the group, like I can't wait. So finally
Yeah,
got to do it.
okay. So when you went in though, what month was this? Probably was it last summer?
It was for the inpatient. It was September of last year.
Okay, so September 2023. And at
Mhm.
that time, were you experiencing like the same symptoms, chest pain, palpitations, that was that kind of stuff? The
Very
same,
severe.
very
Yes, very
severe.
severe. Yeah, I could not get off the steroids, unfortunately. So the steroids were, I noticed the side effects of the steroids with the hair thinning and bone density. I had a bone density test. Unfortunately, I was diagnosed with osteopenia due to the steroid usage. So I was very just downtrodden at this point and said, I'm not gonna be upset. I said, there's no one's gonna cry over this. I said, it's either you're gonna find an answer or you're just going to give up. So I was like, I got to find another answer. So I was on to the next one. So I was like, plasmapheresis is it. So let's do this.
Okay, okay. And so at that time, you're sort of having a combination of side effects of prednisone plus your symptoms when you're kind of going into the plasmapheresis. So you do this for 10 days. And then like how would you say I know that you ended up contracting COVID shortly thereafter there, right? After that treatment.
Yes. So two things. One was during the apheresis treatment, my during one of the treatments, my blood pressure dropped, which is common. I'm usually my body usually reacts late, so I know the nurse got a little freaked out because my blood pressure dropped drastically and I got really lightheaded. But it was nothing to worry about. I was fine. My body handled it, and I felt great as the days progressed.
Okay.
But the one also thing I did not know about that they told me said, hey, your immune system, obviously, we're clearing out not just these auto antibodies, if that's what they are, we're also clearing out your good antibodies too. So you're more susceptible to get sick. So I was like, huh, okay, great to know. In the coming days, of course, I contracted COVID again, unfortunately. This variant was not as bad. I was over it in a couple days. I took Paxlovid that was prescribed to me, and that was it. I was better in like 4 or 5 days, roughly.
Okay, so then after that, what could you say that you like were aware of the benefits of the treatment? Like because you had the treatment, then you contract COVID. So after that, how were you feeling at that time?
So, like I said, was this was all thankful. Like my doctor, I can't credit them enough. Dr. Wainwright was the one who made this happen, and she, was checking in on me. She was unbelievable, checking in to make sure I was okay, and this and that during the whole process. She immediately monitored me. I was also getting a microclot test because I was in the study at Mount Sinai.
Mm,
So I got that done beforehand, and I got that done after. Beforehand, it was positive for the microclots. Again, it's not FDA approved. It's just a study that they have. I guess they're using what Dr. Pretorius uses in South Africa. And afterwards, after the plasmapheresis, I got it done and still positive, unfortunately, for microclots. However, I felt a tremendous amount better. I was able to come down off the steroids to nothing. The
Wow.
first time in forever, I was done with steroids. I was like, this is amazing. I need to continue this. Like this is my answer. And my neurologist was under the assumption too that this can possibly, again, if it is autoimmune driven, that it can correct the body. And so he's like, it's possible that your body, if enough treatments, your body can get back on track, clear out those bad autoantibodies, and possibly do that. I was just like, I'll do whatever I need to do, and that's where I left off with that.
Okay. And then at that point, they recommended the outpatient for you?
Correct. I came to them, and my doctor said, "Hey, we should do 9 more months of outpatient. So you can do this two different ways, as I was discussing, was you can have a catheter put in, a port put in. I'm sorry, catheter. I apologize. A port put in to your chest, which is, again, it's a permanent kind of thing. So I was like, well, what are my other options? Again, I scrambled and found a local place. A lot of people, a lot of doctors don't even know this, that it is offered peripheral. So you can go through your arm. So I found out, hey, I can get it through peripheral. And I was like, that works even better. And that's what I did. I got it done. And now I'm getting it every 4 to 5 weeks, roughly.
Okay. And so, what would you say when you get the treatment, so that they approve this for 9 months is what you said, or for
That's correct.
now anyway. Okay. And when you go and you get your treatment, do you feel better right away? Does it take a couple days? Like, what is that like?
It takes a few days, like 2 to 3 days, to feel better. But I also played the part that I'm no longer, I haven't been on steroids in months now. And I think also, I don't know, again, I have no idea, but it's my belief also that, over time, it's not as good as it was in the beginning, just like the IVIG. Again, I'm also not on steroids. So I think that that also plays a part, that was calming down suppressing my immune system. So now my body is making these quote unquote autoantibodies or whatever the case might be. So I think that plays a part. So is this a cure? I don't know if it's a cure for me. Maybe for others, yes. But it is a temporary treatment that has done phenomenally and helped me get to present day, which I'm very, very thankful for. That, again, I have these doctors and nurses that are absolutely outstanding. The ones in my unit are absolutely amazing, that care enough day in and day out to make sure the patient is comfortable and help us to get to where we are today.
Oh, yeah, no, I know we've discussed before, you have an amazing team of people. Okay, so you get the treatment, you feel, maybe like a couple days, and then like how long, you said about 4 to 5 weeks, how are you feeling during that time? Do you feel like pretty much back to normal? Are you still having some symptoms? They're just lessened?
So they're pretty much lessened to where I don't have, I start getting them back around week 3, a week 3.5. That's when I'll start seeing, okay, I'll start seeing the muscles twitching, which is, a weird autoimmune driven symptom in the past. So I'll see my muscles just start, like I call them, convulsing or twitching, like randomly all over the body. And I'll notice, oh, I'll get blurred vision, or again, some of my other symptoms, or something like palpitations. So I'll start experiencing that, and I'll be like, okay, I know I'm due. I know I'm coming up
Mm-hmm.
for sure. So it's like week 3, week 3.5.
Okay. Do they set your schedule like ahead of time, like, I'm going back this date, or is it more like I'm experiencing symptoms, I'm ready to go in, or they kind of have your schedule set for you like in
So
advance?
you can tell them, like, hey, I think I can make it to a 5th week. I tried that. It did, when I got out to the 5th week, the first time I did it, I was like, oh, I'm not going to do that again.
Yeah.
So I schedule it now every 4 weeks within a day or two. And you just tell them, and they work out at your convenience to kind of make it happen. So, and you can always push it back, but pushing it up is harder. So that's why I always go 4 weeks.
Yeah, okay. So right now, like presently, is it still it's just the same handful of symptoms that kind of come back around like 3.5, 4 weeks, like the palpitations, chest pain, twitches, that's kind of the rosacea and stuff like that. Any
Yes.
other any symptoms that are new, any symptoms that are gone completely, or it's just kind of that same handful that nagging keep coming back up?
I'd say body aches, but they've come and gone. So I get body aches once in a while, like weird neurological pain. I almost like because I get in my shoulder. Sometimes it goes around my collarbone, my shoulder area. I get like weird pain, and it's definitely not bone. It's definitely nerves. I can tell.
Mhm.
So I'm sure that's related in some capacity. But besides that, that's my main majority of symptoms that have kind of followed me, unfortunately.
Okay, yeah. So, I mean, because I kind of, I guess, like for the audience to know, like, this is definitely something that's been very beneficial for you. Obviously, it helps you get your life back, and for the most part, until you have to go again, and you've been off prednisone. So, I mean, all wins right there. And I mean, I'm of the belief that even if something isn't curing you, so to speak, it's still helping your body, right? Because if you're in that constant state of inflammation, constantly on all this prednisone, over time, it's more damage is going to occur. So having that relief from the treatment at least helps your body calm down, helps your body kind of quote like recover temporarily, even if it comes back. But I guess long term, do your doctors have any thoughts for you for is this something that, when 9 months is up, is it something like, hey, we're going to keep trying to extend this? Or are we going to look at a different treatment option? Or what's kind of the feedback right now from your doctors?
So the feedback is pretty much two different courses. We can kind of go either direction. My neurologist, Dr. McAllister, presented, and Dr. Wainwright got me with another physician I consulted with you briefly on. So it's either going to be a monoclonal antibody
Mhm.
that kind of inhibit. I forget the exact name. I sent it to you. I forgot the name off the top of my head of the mAb he was considering to just inhibit inflammation in the body and see if that will kind of make me feel it's not a cure, I guess, but it's hey, it gets you off the plasmapheresis, you're off the steroids, and your body can have a longer rest of combating this inflammation.
Mhm.
Or stem cells. So that's something we've talked about a lot and that you've had. And that's something that they've also looked at. And his belief was a little different. So I had conflicting kind of, which is great. I actually, always listen to doctors on each point of view. And I always tell people get other opinions as well. His was, it needed to be injected in three different places. I believe it was a CSF and two other places for stem cells. And he gave different countries that you should go to that his belief is, some of the best. And then hers were a doctor that she knew that was in hyperbaric medicine that also does stem cells. And I guess their belief was a little different in just injecting it in a couple places, but not like that. And I think I told you the island for that place as well. I apologize. I can't remember for the life of me.
Was Antigua? Was that where it was?
Yes, Antigua. That's correct. My brain fog is still a symptom as well, too. So
Well, no, I remember because when you sent it to me, I was interested in looking up exactly where. So are
Dr.
you
Katz, that was his name. Dr. Katz. I apologize.
Oh yeah, yeah, yeah. Are you at this point? So gonna when would your 9 months like when is that about up?
So he wants it, I think it's 3 or 4 more months, and that's it.
Okay.
He wants to pull the plug. Again, it's something we have, but it's in his mind is, hey, we've progressed, we've exhausted it to where it's great, it's helped you. But if we can find something that's even better and
Mhm.
not as severe in the body or even more long term. So his belief is possibly a monoclonal or stem cells. So again, and that's Dr. McAllister, Dr. Wainwright. They're both, and I've discussed that with both of them. They're both kind of in the belief that's definitely something I can do. So I'm just following the science and listening to them. And like I say, whoever's listening to this, don't get discouraged if you go to one doctor and they tell you you're wrong or they don't believe in this or that. Always get a second, third opinion. Always speak to another physician. As I like to say, that there are some great doctors and great nurses, and there's also some very bad ones, as I'm sure you're aware. And
Right, right. And people aren't familiar with it. People don't understand it. So yeah, you have to find people that know and have experience with it and are going to be an advocate. But like you said, being your own advocate is always number one. And something like I also stress is doing what feels intuitively right for you. Sometimes different things are presented to us like throughout this journey. I was just talking to someone about this today. who was kind of hesitant about that stem cells. And I said, if there's a part of you that's like, this isn't right for me, then maybe it's just not right for you. And granted, we have to work through those things, but like when, with the Patterson protocol, the Moraviroc was kind of like a big thing going around for a period of time. And I just instinctually knew that that wasn't right for me. I even had the prescription. I had 3 big bottles of rock. And there was something inside of me that was just like, I don't think this is the answer for you. So I definitely think, that's part of it. And like you were very much like, you were like, oh, plasmapheresis, like that's like you really felt strongly about that. And so you explored it and it helped you get a lot of your life back. But now it's like, okay, we've exhausted this. Like, what else? So, anyway, I guess the point of that is just saying that we also need to listen to our own instincts, where life is taking us, and find doctors that support that as well, because you are going to find doctors that are going to tell you, like I was told to do the statin and the Moraviroc, and it just wasn't something that connected with me. And I'm not saying that that might not help people, but like that wasn't what connected with me personally. So you kind of also have to look at what feels right instinctually as well. And I think both of those options are honestly probably good options for you. Obviously you'll continue to explore it with your doctors and figure out what's the best route. But I obviously haven't done that monoclonal, but I've had no adverse reactions from either. Like both
Yeah,
have put me in a better place. Monoclonals and stem cells. And stem cells have been around for a long time. If you go to a reputable clinic, I don't think that, I'm not going to say no one's ever had a bad reaction, because that obviously would not be true. Because
of
people
course.
have bad reactions to things, but in general, stem cells are positive. And I think monoclonals, I don't think you're taking a huge risk, I guess is what I'm saying either way.
Agreed.
But of course, we'll definitely want to follow back up, after you're off the plasmapheresis and when you decide to go either route. Because I'm trying to, with this channel as well, I'm trying to follow up with people that have done different things to see how are things working, how are they working long term. And, like you, do you have to kind of switch at some point when you've exhausted the treatment, and maybe it's gotten you where it's gotten you, but maybe it's not going to be able to go much further, basically.
100% agreed. And there's actually, I discussed this with you briefly, and I attended. There's a long COVID clinic at Yale. It literally just opened about a year and a half ago, roughly. Dr. Lisa Sanders. And if you can get in, like I said, to everyone who's suffering from long COVID, at least they are following the science as well there and trying different things. Again, they agree it's the same thing. So they're seeing that's all they see is long COVID, and they're like, we see it's like a big puzzle. What the help for me might not help you,
Mm-hmm.
and that. So, and it's different for every person. So at least they have almost like a treatment plan for whatever type of long hauler they see in place, where it's not a cure, but at least it's a treatment plan where in place. So I've seen that, and they're kind of just great with that. And they have a team there. So you go from seeing not only, a PA, a nurse, and Dr. Sanders, you're seeing everyone pretty much there, a social worker to make sure your mental health's good, and all this great stuff that they have afforded to people who are suffering from long COVID or their family members that are kind of dealing with it as well. So I highly recommend if anyone's out there, also, if they're interested in that, I know it's a wait, but it's the Yale Long Haul Clinic. It's Dr. Lisa Sanders. She was actually even featured on Netflix for some of the stuff, and she writes a lot of articles in the New York Times, I believe. They're phenomenal over there, and that they actually have something in place where they're trying to help as much as they can.
Okay, yeah, I'm just writing down her name. I'll put some of these in the description as well, so people can look this stuff up. And then I know
Yeah.
you have Dr. Peter McAllister, right? And he's a
Yes.
neurologist.
He's a neurologist out of Stamford, Connecticut.
All right. Well, thank you
And
so much for talking to me. Is there anything else that you want to
Dr. Sandra Wainwright is the hyperbaric doctor who actually goes above and beyond to make sure whatever long hauler patient sees the right individual, sees the right doctor. So she's out of Yale Greenwich. She's fantastic. Can't say enough great things about her. Yeah, no, Jacqueline, you've been absolutely phenomenal with helping others. I can't rave about you enough for taking the time out to do these things to help people. You're doing phenomenally today. And you don't have to do these things that you're doing for others out there, and it doesn't go unnoticed. So I greatly appreciate what you do day in and day out to help others that are suffering.
Oh, thank you. I really appreciate that. Yeah, I mean, it's tough because sometimes like I want to remove myself from all of it, but it's like if there are things that are out there, like I still want to know, and I want to know if they're, because I hate the fact that people are still suffering, and I hate that people like feel like so alone and no answers, because I was there and it's a hopeless place. And sometimes if you're not finding the right doctors, you feel like you're just up against the wall, like no one's listening and no one's helping, and it's confusing, and it can be expensive as well, especially people that are doing stuff out of pocket. But I really appreciate you sharing your story and talking, and, hopefully this will help other people that are interested in the treatment. And if there's anyone out there, I guess, that this quote, like, cured and you're off of it and you're good, I'd like to also hear those kind of stories. I know people are traveling outside the country for this treatment, but I don't know anyone besides you personally that's done it. You see things online, but you don't know if someone just gets it done. We really want to know long term, are we seeing, what are we seeing, what effects are we seeing over time as well, because
Understand.
that's also important to know. And that's why, even with stem cells, I want to follow people that are doing that, of course, besides myself, because I want to see, is this a treatment that's helping other people, so that when we talk about it, people can just be fully informed before they make decisions.
Well, I really appreciate it. So thank you again, and from everyone in the long COVID community. So really appreciate what you're doing.
All right. Well, it's great talking to you today. I'm sure we'll catch up and chat soon, but it was nice to
Sounds
see
great.
you. Thank you for sharing.
Thanks for having me.
Okay. You're welcome. Bye-bye.
Take care. Bye.
Please like and subscribe.